This is Aiden. Aiden's a regular 18-year-old boy. He's completing Year 12 at the local high school and plays footy and cricket for the local clubs, and has a tight group of friends he's had since primary school. Recently though, Aiden and his long-term girlfriend had a rough breakup that hit him hard. Not only this, but he's also quite stressed out about his grades and the upcoming exams at the end of the school year. He's always been part of a good home and a loving family. However, lately, he started to feel very, very alone. All of this has led Aiden to be feeling incredibly stressed and has begun to really take its toll on him. He now feels tired all the time and has stopped playing with his friends or going to his sports. He doesn't eat or sleep often enough and has struggled to concentrate on anything at all. Aiden doesn't understand why he feels this way and is incredibly overwhelmed. In an effort to understand and overcome what he's going through, Aiden decides to seek help and find some answers.
Depression is one of the most common mental health problems in the community. Some people may describe themselves as depressed when they are unhappy or sad, but depression is more than just the feeling of unhappiness or sadness. A person who is depressed experiences low mood, which is lower than simply being sad or unhappy. Depression is associated with the difficulty of not being able to function as effectively as usual in everyday life. The severity of this mood disturbance can vary vastly between mild degrees to levels of severe depression, which may be then associated with abnormal or psychotic experiences such as delusions and hallucinations. Low mood is accompanied by a wide range of other symptoms, which also need to be present in order to make the diagnosis of depression.
We now know that we need a drug that can treat depression. Maybe it's sertraline. Sertraline is an SSRI that works within the brain to increase the feeling of happiness so that we can combat the depressing thoughts of depression. To achieve this effect, the drug will cause an increase of the happy hormone, serotonin, to be floating around the brain. To get this extra serotonin, the drug will act to block the serotonin transporter on the presynaptic neuron that will normally take the serotonin out of the synapse and back into the neuron. Blocking this transporter causes serotonin to be left in the synaptic cleft, where it can remain to create the feelings of happiness. Further studies have shown that treatment with sertraline has led to a decrease in grey matter in the left dorsolateral prefrontal cortex, and that seems associated with a decrease of symptoms of depression.
Like most of the drugs, sertraline has different categories of side effects, which include acute or long-term. Acute side effects of sertraline that Aiden may be experiencing include agitation, anxiety and nervousness, sexual dysfunction, difficulty sleeping and gastrointestinal disturbances, which involves stomach aches, diarrhea or constipation and vomiting. More severely, sertraline can lead to long-term side effects such as a loss of appetite, thus no food interaction, absence of cardiac toxicity of tricyclic antidepressants or TCAs, and no anticholinergic effects. Therefore, functions such as salivation, digestion, and urination may not be controlled. Lastly, sertraline can result in serotonin syndrome, which is characterized by high body temperature, agitation, sweating, and dilated pupils, among other side effects. It is advised that sertraline should be taken with caution when used for treatment in children and adolescents.
Overall, the therapeutic effects have been consistent on numerous trials with minimal side effects. As a result, the overall effect of the drug and quality of life from onset of administration is near gold standard. This concludes our video. Thank you for listening.